Hello guys, how are you? Hope you are doing fine. Today we are again here with an amazing series of telling you or continuing the chapter which we have left behind, okay? So first of all, I would like to thank each and everyone for being a subscriber, joining our community, that is the last minute pharma, your exam antidote, okay? So soon we are here, okay? We got many comments that reducing the content size and improving the voice quality. Surely in the upcoming classes we will surely be trying to improve that, and yes, very importantly, in this video we will be uploading the notes also for you. So see, we didn't upload the notes in first video because it was a very small topic, right? But now we are covering the major topics, so we will be providing you notes also, so that you can ace in your examinations, that it be your sessional or it be your university exam, okay? So today we are going to start with the new series, a new topic, okay? So for last class what we had discussed, we had discussed about the routes of administration. What are the different types of routes of administration we had discussed, right? Their advantages and disadvantages. Today we are going to study about the pharmacokinetics and pharmacodynamics of the about pharmacokinetics and pharmacodynamics, okay? This is a very important concept because this concept is there, because if you don't understand that how the drug is going to act on your body or how the body is going to act on the drug, then you will not be able to understand how the therapy therapy is going to work, or how the drug which is there going to help in solving the disease which is going to be there in the patient, okay? So two terms are there which we are concerned over here, that is your pharmacokinetics and pharmacodynamics. So in this session which is there, we will be mainly starting with the pharmacokinetics, and in the upcoming session we will be discussing about the pharmacodynamics. So please try to understand one very important thing. Your pharmacology which is there, it's a combination of pharmacokinetics and plus pharmacodynamics, okay? So what is pharmacokinetics? Pharmacon which is there is derived word from pharmacon, that means drug, and kinetics means movement. Kinetic means movement. So if I talk about what is pharmacokinetics, okay, so pharmacokinetics is nothing but how the body which is there, okay, or if we talk about the pharmacokinetics, okay, so how the body is going to treat the drug, okay, so how the body interacts with the drug, that is your pharmacokinetics. What is pharmacokinetics? Whenever you take a drug, okay, whatever the actions the body is going to go or body is going to do to the drug, that is going to be your pharmacokinetics. Now the question comes, what is your pharmacodynamics? Pharmacodynamics is nothing but what the drug. Now you're taking a drug, okay, very simple question. Why are you taking a drug? You are taking a drug for showing a therapy, right? Or for showing a biological activity, right? So, or to to help it, it's going to interact with the body, right? So how the drug is going to interact? How the drug is going to interact with the body. That is called as your pharmacodynamics. So these two terms are very important, okay? Pharmacokinetics and pharmacodynamics. So what is pharmacokinetics? Pharmacokinetics is nothing but what the body is going to do to the drug. But whereas pharmacodynamics is nothing but what the drug is going to do with the body. Okay? Let's go in detail and try to understand what will come under your pharmacokinetics. In this lecture or in this particular series, we are starting with the pharmacokinetics. So yeah, we are again here to discuss about pharmacokinetics. So for this I have a very amazing story of my friends, okay? Forget about this chemistry like pharmacokinetics and dynamics. Let's go to my friends and let's see what are I tell you one incident which happened, okay? So recently my group is there, okay? We have a group channel which is called as Weirdos Colony, okay? We recently went to a pub, right? Okay, not come on, it's not I know it's 18 plus channel, okay? I guess I can talk all these things. We are going to pub to drink, okay? No doubt in that. So again, I'm sorry, okay, for all my talents watching, I'm extremely sorry. This is just for story purpose. This is not for I didn't drink anything. This is just for the story purpose. I'm explaining for this. That's why I'm telling that we got drunk, okay? So fine. So when we went to a pub, right? So there were usually two things, okay? Some of us, three of our friends which were there, they had the VIP pass, and some of them had the general pass, okay? So the VIP pass which were there, they went off. When they came around like 7:20, and after 10 minutes they went inside the pub. But then people like me, me and some of my friends, like especially the boys people, we had a general pass. So in general pass, we had to wait in a queue, okay? So that was pretty disappointing for us, okay? So usually this is a story. Now, if I take about drugs drugs are just like us. Drugs are just like a friends group. For we are having an analogy, drugs are just like a friends group. Some drugs which are there, they will enter through the VIP gate, and some drugs which are there, they will enter through the general gate. Now what is this VIP gate? What is the general gate? Now see, when you are taking a drug, it has to be absorbed. Similarly, when we went to the party, we have to get absorbed inside the pub. Yes or no? So people who are VIP, they easily went. So the people, the drug molecule, okay, the drug molecule which are lipid soluble. Please note, the drug molecule which are lipid soluble, they can go through the VIP pass. They can enter the blood, or they can be easily absorbed, okay? But whereas those drugs which are water soluble, these drugs cannot be entering through VIP pass, so they have to wait. So if you compare about the lipid soluble drug and water soluble drug, the lipid soluble drugs which are there, they will get easily absorbed. Okay, this was about my friend's story. Same like drugs, right? So some of my friends went to VIP pass, other went to general part. Let us see what happened after that. It has been entered inside the body, it has been absorbed. This process which is there, okay, this process which is there, that is nothing but getting absorbed. That is called as the absorption process. That is called as the absorption process. Okay, this is nothing but the first step of pharmacokinetics. That is, see, pharmacokinetics again, you can remember by your mnemonic which is there, that is your ADME. First one we discussed, that is your absorption. So what is absorption? The drug molecule is going to cross or going to pass through the biological membrane. So now you might be thinking one very important question: why did the lipid soluble drugs go faster compared to water soluble drugs, or why did they get absorbed faster? This is because the cell membrane or the biological membranes which are there, they are made up of lipid bilayer. Okay, they are made up of lipid bilayer. That's why they can be easily absorbed. The drugs which are lipid soluble are easily absorbed, but whereas water soluble drugs are delayed absorption is there. Okay, fine. Let's go for next. Okay. So what happened when I went with my friends, right? When I entered the pub after a long time, we entered into the pub. So we didn't have the same this thing. Like people like me, okay, me and some of my boys, they wanted to go dance. Okay, so we went for dancing. Some people who were there, they were pretty interested in, like chilling out with drinks and all. So they went for chilling out with the drinks, with some drinks. And then some people were there who will never drink, nor they want to dance. The introvert people, they just went and they just chilling out with their friends. Okay. So what is this called? Based on the availability. Based on the availability and interest, we chose our thing, right? Either we want to go dance, we did the dancing part. If some people want to go for bartender, going to chill with some drinks and all, they went to the drink or the bartender. Some people who didn't want to do anything, they just came, sat over there and enjoyed the party, right? Similarly happens with the drug. Once the drug has been absorbed, okay, depending on the drug, okay, depending on the drug's interest, it will either go to the brain or it will go to the particular tissues. So it just depends. This process which is there, the particular drug is getting distributed. Similarly, how me and my friends got distributed based on our interests. Based on our interest, how we got distributed. Even the drug molecules which are there, they are going to get distributed. And this is called as distribution. This is the second D. AD is done, A is done, D is done. This is a distribution. Is it clear? I hope it is clear to you guys, okay? This is a distribution of the drugs. Now, let's come back to my friend, okay? So what happened is, this guy was there, okay? This was like, Mr. Mukesh. Mr. Mukesh guy was there. He was an amazing bartender, okay? So what this guy did, to our original drink, he added some things, okay? Some elements he added. So he made two drinks. He made two drinks. To the original drink, which he gave us two drinks. One was a stronger drink, one was a stronger hot drink, and one was a very chill drink, which does not have any effect, okay? So I guess people, if you're watching my video, obviously you're a pharmacy student, so you should know what is the effect of alcohols, right? So yeah, so it didn't show much effect, okay? So this was a comparatively weak drink. This was comparatively a weak drink, and one was strong drink. So what happens to a drug? When it goes to, here how we are going to bartender, imagine this bartender to be like your liver enzymes. Try to understand this bartender like your liver enzymes. So these liver enzymes which are there, they can convert your drug, the original drug, okay? The original drug which is there, original parent drug, okay? It can convert your original parent drug to either a strong drug or weak drug. Either to a strong drug or weak drug. Now you might be confused between strong drug and weak drug. No, see, usually the drug which you take, no, it's not like, see, it might be a pro-drug. Pro-drug means what? Initially it is inactivated, okay? Initially it is inactivated. Only when it undergoes metabolism or only when the liver enzymes are going to act on that particular parent drug, that time only it will show the action, okay? I hope it's clear. Similarly, here also, some people got effect, some people didn't get effect. Okay, that is because of the depending on the liver enzyme. That is depending on the liver enzyme. So what is happening in the liver? What is the third step that is happening in the liver? That is your metabolism. That is your metabolism. That is the M of the group. That is the M of the group. So what happened? Me and my friends went there. Some people got too high, some people were neutral, and some people didn't have any effect. Right? Why was that there? Because it depended on the bartender, on what type of drinks he made. Right? Similarly, here also, what kind of liver enzymes are going to act on the drug molecule? Depending on that, the drug can be either showing an additive effect or drug will show different effects on that. Okay? I hope it is clear. Okay? Fine. So this metabolism has been done. Now because of metabolism, obviously effects are seen. Yes, obviously effects are seen. So this is the third step. That is your metabolism. Now the last step, but the inevitable one, right? After me and my friends partying, obviously one person got too high. So what is the main thing? I'm here the first timer. Okay. I know. I guess my friends can know who is the first timer over here. Okay. Our senior who is there. So the guy who was the first timer, what did he do? He went to the washroom and started vomiting. Okay. So that was the excretion. That was nothing but excretion. So the inevitable journey. That is nothing but the excretion of the drug. That is nothing but the excretion of the drug. So there are again two things, okay? Either we can go, see, we have to, after the wildfire party and all, we have to exit, right? So two types of exits are there. Either we can exit through your front door, or we can exit through your back door. Okay. So front door means what? That is nothing but the urine. Front door is nothing but the urine. So if you are excreting through the urine, okay, that is the front door. And if you talk about the back door means the biliary excretion. Through the bile ducts when we excrete, that is called as your biliary excretion. So that's the last thing. So any drug you take, first what is going to happen? The drug has to be absorbed inside the body. Friends have to be absorbed. After that, what will happen once the drug comes inside our body? It is going to get distributed. After distribution, what is going to happen? The bartender who is there or the liver which is there, that is going to go in metabolism. Okay, the third step is there. The drugs are going to get metabolized. Okay, so the whatever metabolites are there, okay, they'll be converting the active drug or the drug which is there, that will be converted into metabolites. The drugs which are there will be converted into metabolites. And the final step, what is the final step? That is nothing but the excretion. So this steps, that's nothing but your ADME, absorption, distribution, metabolism and excretion, can be understood with this analogy. So I hope you are able to understand this analogy. Okay, so now let's move in detail about the particular thing. First we'll be discussing about the absorption. So let's go ahead with the absorption part. Okay, so I hope you understood the story of my friends. Now we are going to understand in detail about the drugs. Okay, forget about friends. Let's study on the drugs. So many drugs which are having, they are going through four phases in pharmacokinetics. That is your absorption, distribution, metabolism and elimination. Simple thing. Okay, try to understand. Very simple. You take a drug. Okay, it's going to get solubilized. If it's a water soluble, lipid soluble, it's going to get solubilized. After it's going to get absorbed. First thing is that in the biological system or biological membrane, it's going to get absorbed. Okay, after getting absorbed, what will happen after getting absorbed? It will be distributed. It will be distributed to the various tissues, various organs. Okay, so depending on where that's your site, where the site of action is there, it will go there and get distributed. Or in fact, not depending. See, if you talk, there are two types of drug, okay? It's not important now, but I'll just tell you, there's a conventional therapy or conventional drug delivery, or other one is a novel drug delivery, okay? Conventional means it's going to go to the whole part of the body, and novel means it's going to go new drugs, okay? New technologies, only to target it. We usually want targeted, right? Targeted therapies is what we need. But in conventional, we are discussing this pharmacology for conventional tablets. So what will happen? It's going to get distributed to different parts of the body. After distribution, what is going to happen? It will go to the liver and it will get metabolized. It will go to the liver and it will get metabolized. After metabolism, what is going to happen? After drug is metabolized. What do you mean by metabolized? Metabolized means whatever the drug is there, it has been converted to a metabolite. Okay, whatever drug is there, it has been converted to metabolite. This metabolite will go and show the action. This metabolite which is there, the active metabolite which is there, this will go and show the action. Okay, after the action, what will happen? It has to be excreted or it has to be eliminated. So as simple as that, right? So what do we study? Pharmacokinetics means what the body is going to do to the drugs. What the body is going to do to the drugs. Now, let us understand the first process, that is your absorption. Okay, that is your absorption. Very important process, the primary process, right? That is nothing but absorption. Try to understand this. So absorption means what? See, here you are going to have this is your lipid bilayer. This is your lipid bilayer. So the drug molecule which is there, this has to be crossing this lipid bilayer. This has to be crossing this lipid bilayer. Now, how is it getting transported? In that we are having different types of transport. One is your active transport is there, passive transport is there, then facilitated transport is there, then you are having your endocytosis and your filtration. What is it? Active, passive, facilitated, endocytosis and your filtration. These are the major steps of the absorption. Okay. Now, one more thing you have to understand. Okay, we'll be discussing it again. Okay, but anyways, I'll just tell you. This is a lipid bilayer. If it has to pass through this, I remember I told you about the VIP gate and the general gate. So if the drug is lipid soluble, it will easily pass through the membrane. But if it is a water soluble drug, it cannot be transferred. I mean, if it has to be transferred, what do you need? You need energy. Okay, if this water soluble drug has to enter the biological system, then you need energy. Okay, let's try to understand that based on different types of transport. I hope it's clear. The drug molecule has to enter inside. If it's a lipid soluble, it will easily get soluble. I mean, it will easily pass through. But if it's a water soluble, it will be comparatively difficult. Okay, let's try to understand now. The first one is your active transport. What is active transport meaning? Nothing but when the drug molecule is moving from your lower concentration to higher concentration. So we should understand this. Okay, it's very basic concept. See, whenever there is a gradient, okay, if you are going against the gradient, what is the gradient? Gradient is nothing but difference in the pressure. Okay, difference in the osmotic pressure. So whenever you are going against the gradient, you need energy. So if you are going against it, you are going from low to high. You are going from lower concentration to higher concentration. That is nothing but against the gradient. So here you need ATP. So for those drugs in which ATP, one of the transport is nothing but an active transport. Now this active transport which is there is again divided into two types. That is your primary active transport, and your secondary active transport. What is the difference between your primary active transport and secondary active transport? The primary active transport which is there, that is going to provide the energy. Okay, the source of energy is the ATP. It is done by the hydrolysis. The source of energy is nothing but hydrolysis of ATP. What about secondary active transport? The energy which is there, okay, the energy which is required, that has been obtained because of transfer of certain substrates. Okay, because of transfer of certain substrates, the energy has been obtained. In this again two types are there. What is it? That is nothing but your antipode. And sympode. If the substances are moving together, if two drug molecules are moving together, that is called sympode. If they are going against each other, that is called as antipode. Okay, I hope it is clear. So mainly active transport against the gradient, against the concentration gradient. It's moving from higher concentration to lower concentration to higher concentration, and here you need ATP. Again, you are dividing into two types: primary active transport and secondary active transport. I hope it is clear to here. So mainly the drugs which are going to come under the active transport, okay, the major drugs which are going to come under active transport is nothing but, remember, that is the levodopa. Okay, absorption of levodopa. I just write it over here. I hope you will be seeing absorption of one of the example you can write down. Okay, one of the example you can write down, that is the absorption. Of levodopa. It's nothing but it's a drug which is used. Okay, it's a drug which is used in Parkinson's disease. Okay, so it's nothing but absorption of levodopa in small intestine. Or in the intestine requires an active transport. Okay, now let's go for the passive transport. Very common. This is majorly done by majority of the drugs. Majority of drugs are going to get transported or going to get absorbed in the biological system by this passive transport. So what is passive transport? passive transport means that moving from higher concentration to lower concentration. Movement from higher concentration to lower concentration. That means the movement of drug molecule is going to happen towards the concentration gradient. It's going to happen towards the concentration gradient. Okay, fine. Now this is going to move from higher molecule to lower molecule, and you don't need any energy. So ATP which is there, it is not required. In this passive transport, ATP is not required. So what type of drugs? Majorly, see, here I told you, right? Majorly if we talk about lipid soluble drugs. Okay, majorly I talk about lipid soluble drugs, they can be easily transported. They can be easily transported because both are lipids, so they can be easily transported. So majority of the lipid soluble drugs which are there, they are going to get absorbed with the help of the passive transport. With the help of the passive transport. I hope it is clear to here. Active transport and passive transport. Active transport and passive transport. Now, next is here facilitated transport. Okay, next is here facilitated transport. Now very simple, right? Now facilitation means what? For example, I want to go from one place to other place. Okay, either I can go walking. Okay, either I can go walking, or I can take my motorcycle. Or if I get rich, then I can get an aeroplane maybe from going from one place to other place, right? So what is this aeroplane, motorcycle working as? They are going to facilitate me. They are going to facilitate my transport from one place to other place. Similarly, this transport is nothing but the drug molecule is getting transferred. Not even drug molecule actually, anything which is getting transferred with the help of certain proteins. With the help of certain proteins or certain transporters. Okay, so one of the example over here, that is the glucose absorption. That is the glucose absorption. So mainly the glucose is getting absorbed with the help of a transporter that is called as GLUT transporter. That is called as the GLUT transporter. Many types of GLUTs are there. Again, we'll be discussing it. Okay. So the GLUT transporters which are there, glucose transporters which are there, they are going to these are going to act as a transporter. These are going to act as a transporter, which is going to help by the absorption of the glucose. These are going to help in the absorption of the glucose, and that is called as your facilitated. Facilitation means, see, in this also one more thing you have to remember, ATP is not required. In this, ATP is not required. What is required then? Here we need a carrier. That's why facilitated transport is also called as carrier mediated. It's also called as carrier mediated transport. It is also called as carrier mediated transport. I hope it is clear to you. Okay. Now let's go for the next one. That is the endocytosis. Right? Two things are there: endocytosis, exocytosis. But now here it is absorption. Right? So we are considering for the endocytosis. Okay. So what is endocytosis? Endocytosis means absorption is happening with the help of the vesicle. Okay, with the help of a vesicle. Now, for example, this is your intestine. Okay, this is your intestine, and here your vitamin B12 is there. Vitamin B12. So I want to raise to in the comment section. I want to write down what is the chemical name of vitamin B12. I want you to know what is the chemical name for vitamin B12. Okay, please comment down. I'll check on it. Okay. So the vitamin B12 that is there, it has been absorbed into the large intestine by forming a vesicle. Now just take a understand over here. Here you are going to have vitamin B12. Okay, then the vesicle formation is going to happen. And then they are going to go to large intestine. Okay, and then what is going to happen? It's going to get inside to the large intestine. So this type of absorption which is there, this is called as endocytosis. I think you have seen amoeba also in your 10th grade. What is endocytosis and exocytosis? Similar to that it is. Okay, so what is the example over here? What is the example? Absorption of vitamin B12. Absorption of vitamin B12 in your intestine is an example of the endocytosis. I hope it is clear. Okay. See, they not ask us questions from here. Mainly what you focus that you should know the difference. How each transport or how is the drug getting absorbed, or what are the various ways in which the drug can enter inside the body. Now, last thing which is there, that is the filtration. What is the filtration? What is filtration? You would have done in chemistry, right? Filtration, you add something and then you're going to get this solute and solvent, right? You all have done that, right? Filtrate you are going to get and filtrate you are going to get. So what is that filtration? Filtration means these are only possible for the drug molecules. Okay, this is only possible for drug molecules in which the drug size and molecular weight is very less. Now why I am taking very less? Because these will be so small. The drug molecules will be so small that even between the biological membranes, Even between the biological membranes, this can transport. It doesn't require energy. It does not require energy. So in filtration process, what is going to happen? Even when the drug molecule is very small. See, filtration is only done for those drugs in which the drug molecule size is going to be very small, or the molecular weight of the drug is going to be very small. Okay. So these are the various ways. Okay. These are the various ways in which the absorption is going to happen. What are the different ways? First one is going to be your active transport. Second one is your passive transport. Third is facilitated. Fourth is your endocytosis, and fifth is your filtration. So I hope each and every step which is over here or every different material is clear. So let's go on to the next one. What are the factors which are going to affect the drug absorption? So let us start talking about the factors affecting the absorption. Okay. So this part is there. It is very very important for your exam point of view. They will be 100% if they want to ask any questions from these, right? So this is one of the major question. Okay. That is factors affecting the drug absorption. Now we have already understood, right? What is absorption? I mean, in fact, we have understood what is ADME, but now we have understood what are the different types of absorption we have discussed, right? Now we'll be discussing about what are the different factors, okay? So, one of the major factors tells, one of the major factors is responsible for the absorption, that is the physiochemical property. That is the physiochemical property. What do you mean by physiochemical property? Physiochemical property means of the particular drug. When you are giving a drug, what are the properties of that particular drug? Okay, what are the properties of that drug? Now, the first factor in the physiochemical property is your physical state. So, whatever drug you are giving, in what form you are giving? Is it a solid preparation or a liquid preparation? So that plays a very important role. Okay. So drugs which are in liquid preparations. Okay. Drugs which are liquid preparations are absorbed faster. The drugs which are liquid preparations are absorbed faster, right? So why is it so? Because obviously, right, if it's in liquid state, okay, I will explain you. Okay, I'll explain this topic when I explain you about disintegration time and dissolution time. But now, just remember that the liquid preparations which are there, they will be absorbed faster. But whereas the solid preparations which are there, they are going to take, or they are going to have a slow absorption. This is the first one. That is the physical state. I hope it is clear. Okay. Now we will be going for the next one. That is the particle size. How does the particle size affect? So see, in your slower grades, you will have all heard about this diffusion, right? Passive diffusion, active diffusion. Similarly, it's similar to that. Okay. So when the particle size, if you talk about the particle size, smaller the particle size is, faster is the absorption. Okay, try to understand. When talking about the particle size, it is like faster. Like smaller the size. Okay, smaller the size of the particle is, faster it will be absorbed. Okay, faster it will be absorbed inside the biological system. Because again we have discussed, right, about when you talk about the biological membrane, right? So the minute pores are there. Okay, so smaller the particles, it will be easy. Less energy is required for taking that small particles to the biological system. But whereas larger the particles, okay, if the particle size is large, then what is going to happen? The absorption is going to be slow. Now, excuse me. So one very important concept comes in this. Okay, fine. Larger the particle size, absorption is going to be slow. Certain drugs are there where we need slow absorption. Okay, Let me tell you one case. Okay. For example, I am having the worm infestation is there in my GI tract. Okay, like worms are growing. Okay, so what drug will I take? I will take an anti-helminthic drug, right? So the drugs which are anti-helminthics, okay, they are usually having a smaller particle, right? They have bigger particle size. Now why is that so? Because the particle size is great. So what will happen? The absorption will be reduced. Now why do I want my absorption to be reduced? Because I want the anti-helminthic drug to act on the helminth or act on the worms which are there in my stomach. Okay, I hope it is clear. I don't want that anti-helminthic drug to be absorbed in my systemic circulation as fast as possible. Okay, I want that anti-helminthic drug to act on the worms which are there in my GI system. I want that drug to act on the GI system. That's why the absorption which is there, I am going to slow it down. So see, always don't tell that. Okay, always you do not make a universal statement that larger the particle size is a bad thing for us. We do need larger particles to have an effect, in the case of your antiemetic. I have given you the case study or example of that particular case. Okay. So I'll just tell you, why do we need larger particles? Just one more time if you all understood. Why do we need larger? Sometimes we need larger particle size because in the case of antihelminthics, okay, when there are worms in the GI tract, we want the drug to act on the worms. So we don't want that particular drug to get absorbed faster. Okay, that's why we are keeping that antihelminthic drug in the large particle size. Because if particle size is small, it will be absorbed inside the GI tract. It will be absorbed, right, in the blood vessel and everything. But will it have that effect on the worms? It won't have effect, right? So I hope you understood this part, okay? Now, next is here, very important, disintegration time and dissolution time. Next is the disintegration time and dissolution time. This is very, very important, okay? You have to understand this clearly, okay? So, you are taking a tablet. Let's say you are taking a tablet, okay? What will happen, once you take the tablet, it will go inside the GI. That means, let us understand, it's going to go inside the stomach. Now what will happen? This particle or this tablet which is there will start breaking down, right? Will start breaking down into some solid particles, right? Or the size reduction will happen, right? The tablet size will be converted into particles. The tablet is going to get converted into particles. So this process which is there, that is breaking down the tablet into smaller particles, okay? Breaking down of tablet into smaller particle. This is called as your disintegration. What is this called? This is called as the disintegration. So it is very important to understand what is the difference between disintegration and dissolution. Okay, even after coming till fourth and all, people don't know what is disintegration and dissolution. Okay, what is disintegration? When the tablet is going to break down into smaller particle, that is disintegration. Okay, then the question comes, what is dissolution then? When excuse me, when these particles which are there, will get solubilized. When these particles will get solubilized, okay, when these particles will get soluble in the media. Now in the media means in the GI or whatever the fluid is there, right, or the stomach, water. Okay, when these particles will get whatever the stomach, whatever the secretions are there, or whatever the water is there, when it's going to get soluble, that is called as dissolution. So what is disintegration? Breaking down of tablet into smaller particle, that is disintegration. But when these particles will solubilize, that is called as dissolution. So now can you tell what is dissolution time and disintegration time? Time taken for the drug to break down into smaller particle, that is called as disintegration time. What is dissolution time? Dissolution time means time taken for the drug particles to be solubilized in the media, excuse me, sorry for the disturbance, okay, I'm just having some health issues, so maybe next videos that will be all corrected, okay. So just try to understand what is disintegration and what is dissolution. I hope it is clear to you, okay. So now, what if we talk about disintegration time? What is absorption? How does absorption affect dissolution? How does dissolution time and disintegration time affect the absorption? Like, if you are having smaller disintegration time, if the time taken to disintegrate is less, and if time taken to dissolution is less, then absorption is going to be faster. So absorption is faster when the dissolution time and disintegration time is going to be less. So for absorption to happen, the dissolution time of a particular tablet or particular drug should be less, and even the disintegration time should be less. I hope it is clear to you. Now, next we'll talk about the formulation. Now, what does formulation mean over here? Formulation means, see, we are taking a drug, in the drug, you are having two things. We always studied that. One is your excipient, right? What is the other one? What is the excipient? Other one is your API. What is API? API is nothing but active pharmaceutical ingredient. Right? So this API is mixed with the excipient, right? Now, what is the excipient actually? These are inert substances, okay? But they can affect the absorption. Okay, these are inert substances, but they can affect the absorption. Now, for example, if you talk about what are the inert substances you are using, like binding agents you are using, right? Like starch is there, then lactose is there, then you are having your calcium salts, right? Calcium salts are there which you are going to use, right? But if the API, one example I'll give you, okay? Many examples are there. One example I'll give you. If the API is your tetracycline, tetracycline. Okay, if you are giving tetracycline, if you are formulating in such a way that tetracycline you are using the binding agent as calcium salt. Okay, in the tetracycline formulation, if you are using binding agent as calcium salt, then what will happen? Calcium will interfere. Okay, note it down. Calcium will interfere with the absorption of the tetracycline. Okay, calcium will interfere with the absorption of the tetracycline. Now, how it will do, we will learn in further classes. How we will do, we will learn how it will interfere, we will check in the further classes. But now it's very important that calcium which is there, it will interfere with the tetracycline. I hope it is clear till here. I hope till here it is clear. Now, next we will go for the routes of administration. Next we will go for the routes of administration. So we have discussed, no, very simple. What are the two routes of administration we have in? One is here systemic route of administration. Sorry, one is your local, like your local route of local is there, no? Local effect, right? Local drugs are there. Other one is the other one. That is the systemic. That is the systemic. Now in systemic, what are we having? Maybe I have told you about. That is your parenteral. That is your parenteral. Okay, so these parenteral drugs which are there, parenteral drugs means what? Those drugs which are directly going to go inside the blood vessel, like injections we talked about, right? So these drugs are going to have faster absorption, because see, okay, not about absorption actually, but these drugs are directly going to go into the blood vessel, no? Yes or no? So which route of administration you are doing? In that also absorption will matter, right? So for example, if you talk about local, like tablet, conventional one. So it will take faster, it will take slower time, right, for showing the action. But if you take the IV route or we take the parenteral route, here we are bypassing the absorption. Here we are, what are we doing? We are bypassing the absorption, right? So route of administration which is there also plays a very important role. Routes of administration which is there also plays a very crucial role in telling about the drug absorption or in deciding the drug absorption, whether it be faster or slower. Okay, fine. Now next one which is there. Next is going to be your pH and ionization. Next is going to be the pH and ionization. So try to understand this, that whichever drugs are going to be in the form of ions, or which will ionize easily, right? Which will ionize easily. These drugs are difficult to get absorbed. These drugs are difficult to get absorbed. So those drugs which will ionize easily. Okay, when you are going to add in the water, are going to solubilize it, they will ionize. What are ions? Like cations, like positive. When they get charges, okay, they will have difficulty in the absorption. They will have difficulty in the absorption. So which are those drugs? Mainly here, two are there. If they are strongly acidic drugs. Strongly acidic drugs. What's the example of strongly acidic drugs you are going to have? You are going to have your heparin. You are going to have your heparin. Heparin is an example of a strongly acidic drug. It will ionize easily, okay? That's why it cannot be absorbed, okay? Now, what about the next one? That is going to be strongly basic drugs. What are the strongly basic drugs which are going to have? The strongly basic drug which is there, that is your amino glycosides. So what is the amino glycoside? Amino glycoside is nothing but coming with the category of antibiotics. It's coming under the category of the antibiotics, okay? So those drugs which are like either going to be strongly acidic or strongly basic, they will be having difficulty in absorption. They will be having difficulty in the absorption. I hope it is clear till the pH ionization. Okay, fine. Now let's go for the next one. That is food. That is food. Now in your hospital, right, whenever you go for a clinic, whenever you go to your family doctor and all, you take some medicines, right? Especially this season, you know, like very take care of yourself, okay? You're very, like, you know, versatile, right? Everybody is getting fever, cough. So I hope you're taking care of yourself. So in the food, right? So you're having two things. Some drugs are there which they will tell that the doctors will prescribe to take before food, okay? But whereas some drugs which are there, they will tell you to take after food. After food. Okay, why is that so? Yes, that is because of absorption only. Okay, so food which is there, it can alter the absorption of the drugs. So some drugs which are there, okay, they will be absorbed very, very good when the food is present. Whereas some drugs are there, when the food is there, the absorption will be comparatively slow. Let's try to understand with some examples, okay. So what are the drugs which are supposed to be taken, you know, like before food? Mainly that is here. Mainly the rifampicin. Mainly if we talk about rifampicin, Okay, these drugs which is there, no? This is also when you take with the food. Okay, when you take with the food, it's going to have lesser absorption. It's going to alter the absorption. That's why the drugs like rifampicin which is there, the drugs like rifampicin which is there, that is mainly taken before the food. That is mainly taken before the food. Now, what are the drugs which should be taken after the food? What are the drugs which should be taken after the food? Or in the stomach, when food is there, at that point of time, the drug should be taken. That is mainly your very common drug. That is your NSAIDs. That is your NSAIDs, right? Like you're having a paracetamol, you're having your aspirin. Why are we supposed to take after food? Because when you take this drug before, if you take it like in an empty stomach, if you take this drug in the empty stomach, these drugs have a tendency to irritate the gastric mucosa. It has a tendency to irritate the gastric mucosa. So because of that, it will cause gastric irritation, gastric disturbances. Okay, that's why these drugs which are there, they're supposed to be taken after the food. After having something, you're supposed to take this NSAID kind of drugs. Now one more is there. Okay, that is your grisofluin. Grisofluin. This is an antifungal drug. This is an antifungal drug. Okay. This drug is comparatively well absorbed. Okay, just remember, this drug is there. It's comparatively well absorbed when taken with fatty acid food, like fatty meal. Okay, when taken under your fatty acid. So when you take this drug with the fatty meal, when you take this drug with the fatty meal, you are going to have the faster absorption. That is the grisofluin that will come under the antifungal drug. That's antifungal drug. Okay, I hope it is clear. I hope it is going well. You are understanding the things. Okay, so fine. Let's go for next topic or next heading, that is here area of absorption. Let's try to understand what does this area of absorption mean, right? It is very simple, right? More the area of absorption, or more surface area, faster the absorption. Right? So mainly where does the absorption happen in your stomach or in your GI tract? That is the small intestine. That is the small intestine and large intestine, right? But now, in sometimes, because some diseases, certain diseases, they have this procedure of the gastric resection. Okay, there is some procedure which is called as gastric resection. What does this gastric resection mean? Gastric resection means because of certain diseases, they are going to surgically remove a part of the gastric area or the GI tract. They are going to remove either in the small intestine or large intestine. Because of certain condition, they are going to remove it. Okay, so for that, what will happen? If you are removing that part, what will happen? The area of absorption will be reduced. So if area of absorption is reduced, what will happen? The absorption which is there will not happen properly. As simple as that. This is very simple. That is the area of absorption. Mainly what you remember about the gastric resection. What is gastric resection? It is the removal of the part of any of the GI system. Okay, like maybe mainly it is your gastric region, or maybe it can be small intestine or your large intestine. Okay, I hope it is clear. Now, a very interesting part, that is the gastrointestinal diseases and other diseases. How does it affect the absorption? This is very interesting, especially for me. Okay, so when I talk about the gastrointestinal disease, okay, when I talk about the gastrointestinal disease, the first disease which comes to the mind is your gastroenteritis. That is your gastroenteritis. Okay, so what happens in gastroenteritis? In this particular disease, what happens is the peristaltic movement is there, right? GI system is going to have a peristaltic movement. So this peristaltic movement which is there, okay, this is going to be comparatively fast. Okay, please remember, in gastroenteritis condition, what is going to happen? The peristaltic movement. What is peristaltic movement? Rhythmic contraction, relaxation of the GI tract to push down the food. It will be comparatively faster. Now try to understand, if peristalsis is faster, what will happen? The amount of time the food is going to be in contact with the large intestine and small intestine is going to be reduced. Are you understanding? So what is happening in gastroenteritis? In this, the peristaltic movement which is there, that is going to be increased. So if peristaltic movement is increased, then what will happen? The time for absorption is going to be decreased. So then drug will not be able to absorb properly. I hope this is clear to you. That is the gastroenteritis, what is going to happen. Now, one more thing which is there, that is your CCF, congestive cardiac failure, right? In congestive cardiac failure, what is the major thing you will have? There is something called as GI mucosal edema. There is something called as GI mucosal edema. So whenever there is a congestive cardiac failure, okay, whenever there is a special case of congestive cardiac failure, what is going to happen? You are going to have a GI mucosal edema. So because of this edema or GI mucosal edema, the absorption can be delayed, or the absorption which is there, that is reduced. The absorption which is there, that is reduced. I hope it is clear. So these are the major factors. Okay, these are major factors which are affecting the absorption. These are major factors which are affecting the absorption. Now, next we have to understand, okay, before going to distribution topic, there is something very interesting happening, okay. That is about the first pass metabolism. What is, okay, before first pass metabolism also, you're supposed to understand what is bioavailability and how is bioavailability, or what are the factors affecting bioavailability, okay. And one of the major factors is affecting the bioavailability of a drug. Okay, you guys don't know what is bioavailability, don't worry, I'll explain you, okay. So what is bioavailability? How bioavailability is going to affect, or how the first pass metabolism which is there is going to affect the bioavailability. We'll discuss it out, okay. Let's go for it now. Okay, so now let us discuss about the bioavailability, okay. This is a very important topic we have to understand. What is bioavailability? So you understand what is absorption, right? The drug is going to go, it's going to get absorbed inside the small intestine, and then it is going to enter inside the systemic circulation. So what is bioavailability? Bioavailability is nothing but it is the fraction of the drug, okay. Bioavailability is nothing but it is the fraction of the drug which is there or which is present in the systemic circulation, because obviously, right, only when the drug is going to enter inside the systemic circulation it is going to show you the action or the therapeutic outcome, right? So the bioavailability means nothing, it's the fraction of the drug which is going to reach in the systemic circulation, okay. So obviously, if you talk about IV, intravenous you are giving, or you talk about parenterals, right, what will be the bioavailability of those drugs? Obviously, it's going to be 100%, because whatever drug you are given, whatever dose of drug you are given, out of that 100% of the dose is going inside the systemic circulation. But whereas, if you take in different formulations like tablets we talk about, syrups we talk about, okay, in that cases, the bioavailability of the drug is nothing but it is the fraction of the drug which is going to reach to the systemic circulation at a given dose. For example, you are going to give 500 mg of your paracetamol. Out of 500 mg, not all the 500 mg of the drug is going to go enter inside the systemic circulation. Only some fraction is going to get inside the systemic circulation, and that is responsible for giving you the action. And that is what is called as your bioavailability. That is also called as your bioavailability. Now, one more term is there which comes similar to this. That is bioequivalence. That is nothing but your bioequivalence. So what does this bioequivalence mean? Okay, bioequivalence means when you are going to give two formulations, okay, or two drugs are there, okay. For example, there are two companies, okay. There is company A, there is company B. They have manufactured paracetamol. Now there will be a standard according to Pharmacology. There will be a standard that when you are going to, like, when you are going to give this particular tablet, this much should be the bioavailability, or there will be a standard drug. So that drug, that particular standard drug will be having a particular bioavailability, right? So those drugs, I mean, for example, the standard drug and the drug which is made by company A, when they are going to have similar bioavailability, that is called as bioequivalence. So what is bioequivalence? When two drugs are going to have excuse me. So when two drugs which are there, they are going to have the same bioavailability. Those drugs are called as, bioequivalent drugs. Okay. I hope it is clear. Very simple topic. Bioavailability, bioequivalence. Definition questions are possible. Okay. Now, next we have to understand what are the factors affecting bioavailability. What are the factors affecting bioavailability? Okay. So whatever factors we are learned for absorption, right, all the factors are going to affect your bioavailability also. Because obviously, right, if the drug is not getting absorbed, yes or no? If drug is not getting absorbed, then from where the bioavailability will come? Yes or no? For the drug to be bioavailable in the systemic circulation, it has to be absorbed, right? So whatever factors are coming in absorption, all are there, all you can take for factors affecting bioavailability. But some major factors which are there, that is your first pass metabolism, hepatic diseases, and enterohepatic cycling. And that is your enterohepatic cycling. Okay, let's try to understand this in detail. Okay. So a very important topic, that is your first pass metabolism. That is your first pass metabolism, also called as pre-systemic elimination. Also called as pre-systemic elimination. Okay. Now trying to understand actually. First I will tell you what is normally supposed to happen or what is normally happening in your body. Okay. You take a drug. Let us say take this is your particular drug you are taking. Okay. This is your particular drug which you have been taking. It will be entering inside the stomach. Yes or no? It will be entering in the stomach. It will be like dissolved. Whatever drug particles are there. Okay. Now after that, what happens over here? Try to understand. From the gut wall, some part of the drug will be entering inside the portal vein. There's a vein which is called as hepatic portal vein. There's something called as hepatic portal vein. So what happens over here? This gut wall, through the gut wall, it will be absorbed. This drug will be absorbed and will be going to the portal vein. From the portal vein, it will take the drug to the liver. It will take to the liver. And in liver, what will happen? Your first pass metabolism. What will happen? First pass metabolism is going to happen. And what is metabolism actually? So whatever your drug you are taking, right, you are inactivating that drug. Okay, metabolism means you are going to inactivate that drug. Okay, for example, you are taking a drug, it should be distributed and it should show action. Yes or no? That's what is ADME. First of all, the drug which is there, it has to be distributed and show the action. But in first pass metabolism, what is happening? Before it is getting distributed, it is going to go to the liver to get metabolized and will convert the. What will this do? What will this do? This is going to. This will reduce the bioavailability. Okay, this will reduce the bioavailability because how? Now, for example, after getting the first pass metabolism, this drug which is there is inactivated. This drug which is there, it is inactivated. That means it will not show any therapeutic outcome. It will not show any therapeutic outcome. In fact, it can cause other systemic reaction. It can show, but it won't show any therapeutic outcome. So what will happen over here? If this contains a systemic circulation, it's a waste of the drug, right? It's nothing but wastage of drug, right? Yes or no? I hope you are understanding. This is what is first pass metabolism. This is going to decrease the bioavailability. Now see, I told you it is nothing but fraction of drug which is available in the systemic circulation. Let's modify that a bit now. Bioavailability is nothing but fraction of drug which is available in the systemic circulation which is capable of showing the therapeutic outcome or which is capable of showing the therapeutic or potential of the therapy. Okay, now what is going to happen in this? This is your first pass metabolism. Okay, this is your first pass metabolism. But actually, what should have happened if you want good bioavailability? What should have happened? The drug, instead of going to the portal vein, it should go to the small intestine. Okay, from small intestine it will be absorbed. From small intestine it will be absorbed in where? It will be absorbed in the villi. You know what the villi is there. It's going to absorb the drug. Then this is going to enter inside the. This is going to enter inside the systemic circulation. Yes or no? This is going to enter into the systemic circulation. So if this enters into the systemic circulation, this will show the outcome or whatever therapy, or this will show the therapeutic outcome. This will show the therapeutic outcome. This is what should have happened. Okay, this is what should have happened. But because some drugs which are there, they are going to have high first pass metabolism. So what will happen? For example, you are giving 100 mg of drug. You are giving 100 mg of drug. Out of 100 mg, 80 mg of the drug is going for first pass metabolism. Only 20 mg is available to show therapeutic outcome. So will you get a therapy? Will you get a particular whatever outcome you want? Will you be getting that? Obviously not, right? So those some drugs are there, like a lignocaine, that's a local anesthetic, right? So these what do we do? We just convert the route. Okay, instead of giving in oral format, we directly give it intravenous because we saw that intravenous drugs which are there, they are going to have 100% bioavailability. I hope you are understanding with this. Okay, so this is your first pass metabolism. Okay, now next let's talk about your hepatic diseases. Okay. So what is happening in hepatic diseases? Okay, so hepatic disease means your hepatic enzymes are being damaged. Okay, so in this what is going to happen? The hepatic enzymes or liver enzymes which are there, which are responsible for metabolism, okay, there are certain drugs or there are certain enzymes which are responsible for metabolism. So these hepatic enzymes will be secreted less or will not be produced well. So if hepatic enzymes are not there, will the metabolism happen? No, metabolism will not happen. So if metabolism won't happen, then what will happen? The bioavailability of the active drug, okay, the bioavailability of the active drug in the systemic circulation in the systemic circulation, okay, the drug concentration will be increased, or drug concentration which is there will be more. Okay, so if drug concentration is more, then what will happen? It should, see, you want after showing therapeutic outcome, you want the drug to be excreted out, right? Or you want the drug to be converted into inactive form. But now, because of some hepatic disorders, what is happening? The hepatic enzymes are not there. So because hepatic enzymes are not there, metabolism won't happen. So if metabolism doesn't happen, the drug concentration will increase in the systemic circulation, and this is what is going to lead to the toxicity. This is what is going to lead to the toxicity. So the main drugs which are there is hepatotoxic. So people who are having hepatic disease, you should take care of these drugs. Whatever hepatotoxic drugs are there, you should take care, because liver enzymes will not be metabolizing these drugs, and if you don't metabolize this drug, then what is going to happen? It will lead to the drug toxicity. This is nothing but your hepatic diseases. How does your hepatic disease, okay, affect the bioavailability? So what is it doing? Hepatic disease is going to increase the bioavailability, okay, but whereas first pass metabolism which is there, it is going to decrease the bioavailability. I hope it is clearly here, okay. Now next we are going to go for enterohepatic cycling, okay. This is very important, okay, enterohepatic cycling. Very important and interesting too. Okay, this is very important and interesting also. Let's try to understand this. Okay. Now, this is your stomach which you are going to have. This is your liver. Okay. Then here you are going to have the GI. It's the stomach. Okay. And then here you are going to have the small intestine. Here you are going to have the small intestine. Okay. So what happens over here? Some drugs are there that excreted via bile. Okay, some drugs are there, or some drugs are there that are excreted via bile, and some drugs are there which will be absorbed by the small intestine and will be going to the liver. Okay, for the small intestine, these drugs will be going to the liver. Are you understanding? Or some drugs, okay, because see, some drugs from systemic circulation, okay, if they have to be excreted, either there is urine through urine can excrete, or through bile it can excrete. Okay, so if it's excreting through bile, then what will happen? Take a lesson over here. Here you are having the gallbladder. Yes, no. Here you are going to have the gallbladder, and gallbladder is going to be responsible for what? For giving your bile juice, right? Yes or no? For storing your bile juice. So from this, what will happen? Your bile juice is going to be excreted. Your bile juice is going to be excreted, bile juice is going to be produced. So what will happen? Trying to understand, certain drugs which are there, they will be absorbed from the small intestine or will be excreted via bile. Okay. So what will happen? This bile will directly again enter inside the intestine. This will again enter inside the intestine. And in the intestine, what is there? In the intestine, what is there? I mean, in the bile, what is there? Drug is there. So what will happen? The recycling. Okay, the drug is getting recycled. So those drugs which are excreted via bile, okay, those drugs which are excreted via bile, they are going to have a prolonged action. Why prolonged action? Instead of getting excreted out of the body, it has been absorbed inside the bile, and again that bile is going to enter inside the intestine. Then again intestine, what will happen? Again absorption is going to happen. So for those drugs, those drugs in which we require, like some drugs are there which will help us in providing the prolonged action. Like your morphine is there, doxycycline is there. They have this enterohepatic cycling. So what is enterohepatic cycling going to do? Enterohepatic cycling is there. It is going to increase the bioavailability. So I hope you are clear. The main factors that are affecting over here, all the factors of absorption, and you are having your first pass metabolism, hepatic diseases, and your enterohepatic cycling. In this, first pass metabolism and your enterohepatic cycling is a very important concept. So always try to remember, drugs which are going to have high first pass metabolism, we usually won't give in the oral format. We will try for some different route of administration like IV or some other route, okay, in which we can increase the bioavailability. Whereas hepatic disease, what is going to happen? Drug metabolism won't happen because liver enzymes won't be secreted. Drug metabolism won't happen. If drug metabolism will not happen, what is the main problem over there? If the enzymes are not getting secreted, then drug will not get metabolized. If drug doesn't get metabolized, what will happen? Then it's going to lead to the increasing bioavailability. If we increase bioavailability, what will happen? The concentration of the drug is going to increase in the systemic circulation, and that is going to lead to the toxicity of that particular drug. And then last comes here enterohepatic cycling. That is an enterohepatic cycling. That means, very simple, some drugs are there which are excreted via bile juice. Okay, so what will happen? This they come inside the liver, then enter the bile juice. Okay, this bile juice again, you know the importance of bile, right? The bile again go to small intestine. Yes or no? The duodenum region with the pancreatic juice, even bile juice will be going. So bile juice, what does it have? It has the excreted drug, right? It has the excreted drug. So instead of getting excreted completely outside the body, what will happen? This drug will again enter inside the small intestine, and again it will show the action. So this drugs will help in prolonging the activity or prolonging the action of the particular drug. I hope you understood. Okay, these are the major factors which are going to affect the bioavailability. Okay. So, in the next session which is there, we will be discussing about the drug distribution. Okay, next video we will be discussing about the drug distribution. We understood about the absorption. What are the factors affecting absorption? Then bioavailability. What are the factors affecting bioavailability? And then we'll understand how the drug is going to be distributed to various regions of the body, and then show the therapeutic outcome. And when it's going to show therapeutic outcome, that time we'll be checking about the pharmacodynamics. Okay, so stay tuned with the further lectures which are going to come. I hope you're making notes. Whatever this thing is there. Okay, whatever your notes are there, we are planning for a new Telegram channel. Okay, do join the Telegram channel. You will get all the notes which is required for your B Pharm and Pharm D and diploma examinations. So don't worry, we are here with you. Let's go, keep supporting us. Okay, if you are liking and subscribing, and we are getting some motivation, then we can do more and more such videos and get more and more subjects and help you guys with this, with your last minute pharma, your exam antidote. Let us end this session today. Thank you everyone. Have a good day. Ciao.